Okay, this is Jeff, and Jeff last April had to run down a hill chasing a heavy cart with a load on it, and in doing so he popped out his right knee, and it's taken quite a long time to heal, and maybe it's 80% better. It's just not like it used to be. The other thing is his left knee, it's just kind of like an old knee. No specific symptom, so mainly in the morning when he gets up, it's just not that youthful bounce and step that he wants. So what we're going to do is figure out if chiropractic can help this, if there's anything else, anything I can find. And so what we're going to do is we're going to have him lie on the table. We're going to do a few tests. And rather than just doing therapy on the knee and hoping for the best, or physical therapy, what we're going to do is we're going to look for weaknesses, maybe a subluxation, a misalignment. Maybe the knee is fine and it's somewhere else inhibiting the nerve supply to the knee. That could be. So first of all, we're going to see how he does with strength tests. Hold your leg up. Oh, it's very strong. He's just like iron. Lift this one up. Very strong. So what I'm going to do is just test the leg in general. Push out to the side.
Push out.
Good. Relax, relax. Push to this side. Okay. So now we're going to put a few torques in here. Bend your knee, bend your knee. And I'm going to pull his leg. Hold it. Very strong. Now I'm going to twist his foot this way. Hold it. Hold it in.
Hold it in. Okay.
I found one weakness. He can't hold his ankle. Now it seems like an ankle test, but it's really, it's called a popliteus test. It's the muscle behind the knee. So it's not firing correctly to stabilize this knee. Let's see if it's any part of the hip. Bend your knee. And I'm going to pull it. Relax. I'm going to pull it here. Relax. I'm going to pull it here. Okay. So I want to see if the ankle is in some way involved here. So I'm going to, when his foot is this direction, there's no way I can pull this leg down. I would like you to point your foot. Whoa! Look at how weak that is. He literally cannot hold this leg at all. So what we're finding is that probably there's something wrong with this ankle. And we're going to figure that out in a minute. Let's see if that happens on this knee. Hold it. Now point your leg. Hold it. Okay. Now bend your knee a little bit. Turn your foot in, and I'm going to try to crank it back. That's the way it should be. It should not bend your knee. Turn your foot in. It should not be that way. I can literally just pull this leg right off. I'm going to pull your leg up. I want you to push it down. Push down. Good, very strong. Relax, relax, relax. I'm going to pull his leg this way. Hold it. Very strong. I want him to turn his foot this way, outward. Hold it. Turn it forward, inward. Hold it. Wow. So when he activates this inner calf muscle, it's called the tibialis posterior, when he activates that muscle, it inhibits his hamstring. So in effect, when he's walking, what's happening is his hamstring, his popliteus, and his tibialis posterior are not firing. So orthopedic doctor would only look at the knee joint. But we're going to look at everything else that's related to this. So we have to see whether or not this is a pelvic issue causing all of this, or is it a foot problem. So I'd like you to touch right here, and we're going to do a test to see if there's any weakness in the pelvis. Touch right here. We're going to hold your leg up. Hold it up. No, it's fine. We're going to touch right here. We're going to touch right here. Put your other hand. Hold this up. Okay, so it doesn't seem to be a problem from the waist down. And since he was able to do all the tests of the knee, I think I will not go to the knee. We're going to go to the ankle. He's going to hold his foot in. Hold it in. No, he can't hold that, even though he's a big guy and very strong. Okay. I'm going to grab an instrument. And I am suspecting subluxation of the ankle. So we're going to give it an experiment. Okay, you're going to hold this foot in. Wow. Okay, bend your knee. Turn your foot in. Hold it. So, his ankle was slipped slightly out of place. Problem in the rut, or maybe even before that. We're not sure. So now the question is, we go back and see whether or not the hamstring is misfiring. He's going to turn his foot in, and I'm going to pull. Now, if that went weak, then that wasn't the only problem. I'd have to figure out something. Okay, our next test is this. Real life is not laying on chiropractic tables. So what we're going to do is we're going to have him stand up, hold on to the table. He's going to lift this right leg up this way. And I'm going to push it down, testing his hamstring while standing. Hold it. Okay, so while standing, it's not so good. I'd like you.
Yeah. And I felt it right here, buddy.
Yeah. So that created, drop the other arm, hold this arm up, hold it up, relax. So what we found here is that the nerve attachment that controls the pelvis right at the top of the hamstring on the ischium, right here, is not firing on the opposite side. So he's not strong when he's in left stride, even though he has a symptom in the right knee. So I'm going to do an adjustment into that area. And we're going to see, treating the left hip, if that has an effect on this leg. Just keep your body straight, lift up your leg. No, backwards. We're doing the hamstring. Yeah, just don't bend over. Stand up straight. Touch, hold it there tight. So now we found two things. The right ankle, but the left hip that most doctors wouldn't even look for. Turn around. Now, hold on. Just bring your knee up to the level. Hold it. Bring the other leg. Wow, how about that? This left leg seems to be a bigger problem than your right leg. Okay, so you're going to bring that knee up, hold your arm up, hold it, and what we found here is the following. It seems like both nerves at the hamstring, gluteus, are not firing correctly. So you're going to raise the left knee up and down while I stimulate this neuromuscular reflex. And we're going to see what happens. Bring that knee up. Now there's all my weight. So we found that he had an inhibition of certain muscles and patterns, and of course it's demonstrated in his knee, but in reality has many other problems that have to be fixed. I probably will not have to do that again. Usually when we turn the system on, it stays on, unless he has some crazy habit that we don't know about. Okay, so the next thing that we have to tell is whether or not there's an engineering problem from the feet up. So what we're going to do, this is a test for that. He's a big guy, and I'm going to pull his hands down. I shouldn't be able to move this. Hold it. No, he literally can't do it. So you can imagine him carrying a heavy bag, backpack, or any equipment. He has to struggle, and this is putting great stress throughout his body. He might get backache, change in his posture, and so forth. We are going to do a special test. He has a major issue with his feet. He's highly pronated. This will put great stress on his knees, his hips. In fact, most people that eventually have to have a hip replacement or a knee replacement, it's always, unless they were clipped, they have a major injury. Basically, it's almost always due to the chronic effect of pronated feet. So we're going to do an experiment here. I'm going to put him in a sample 3-arch orthotics. These are different than other kinds of orthotics. Put your feet in there. Put your heels in the right place. And we're going to do an experiment to see if this cracks it. Let me have your arms. Hold it. Now he can literally hold my weight up. I cannot break it no matter what. Hold your arms. Now, we're not going to change any dynamic here. You're going to step off, leaving your arms exactly the same place. Hold it. With no effort at all, I'm not even trying, I can take him down. So what would help him the most, besides some chiropractic, maybe losing a little weight, maybe a dietary, maybe some minerals that I'd have to give him. But if we do not fix his feet, almost all the future treatment will be temporary and won't have the greatest effect. So what you need to do is what I did, and that is I need to cast you and make you orthotics that you will wear all the time. Now, think of this. Let's say there's 1 million steps in a year. I don't know how many, but let's say. It's either going to be 1 million wearing out, 1 million little tiny car wrecks, or it's going to be 1 million chiropractic healings. And at the end of a year, at the end of 3 years, you're going to be twice as healthy, your posture will change. And you will be dynamic. Almost all posture comes from the feet. It doesn't come from working out. Okay? So that's what we have. I think we fixed about 4 things in him that nobody would really even look for. And we found the baseline. Had he had these and he chased that cart, probably nothing would have happened to me. There you go, Jack.